Hypertension is something that is plaguing our community. According to the CDC in 2014 to 2016, the hypertension death rate was 150 per 100,000 people for San Joaquin County alone. About 75 million adults, 32%, have high blood pressure. That's 1 in every 3 adults. About 1 in 3 American adults have prehypertension. That's blood pressure numbers that are higher than normal, but not yet in the high blood pressure range. Only about half, 54%, of people with high blood pressure actually have their condition under control. It is the most common chronic disease among adults in the U.S. High blood pressure is when your blood pressure, the force of your blood pushing against the walls of your blood vessels, is consistently too high. There are different stages of hypertension, and you'll see them in the chart below.
Patients with hypertension are often asymptomatic, and according to the CDC, it is known as a silent killer. Although you can have symptoms such as headaches, shortness of breath, nosebleeds, and vomiting, which could indicate that your blood pressure is really high. Most of the time, when signs and symptoms occur, your organs are already involved, and so the symptoms are more organ specific. So, for example, you may have chest pain, and that may indicate some heart involvement, and or you could have slurred speech, weakness, dizziness, and that could be maybe an impending stroke.
Who does hypertension affect? Well, 60% of people with diabetes also have hypertension. Diabetics have a buildup of sugar in their blood. Having an unhealthy diet is also a risk factor for developing hypertension. If you intake too much sodium, which is commonly found in table salt, it can eventually lead to high blood pressure. Having a diet rich in potassium, which is found in bananas, yogurt, and beans, can help reduce your risk of developing hypertension. Physical inactivity and obesity can also cause you to have high blood pressure. Excess body fat wreaks havoc on your blood vessels. Smoking increases your chances of developing hypertension as tobacco causes damage to your heart and blood vessels, causing blood pressure to rise and decreases the amount of oxygen traveling throughout your body. Drinking too much alcohol can also cause your blood pressure to rise. Genetics, age, race, and ethnicity are non-modifiable risk factors for hypertension. Hypertension is diagnosed by measuring your blood pressure. Your blood pressure can be measured by a nurse or physician by wrapping a cuff around your arm. A machine will cause the cuff to inflate and measures the pressure in your blood vessels by millimeters mercury. The first number represents the amount of pressure in your blood vessels when your heart beats, and the second number represents the pressure when your heart relaxes. A normal blood pressure reading is less than 120/80. Prehypertension is between 120/80 and 139/89. Stage 1 hypertension is 140 to 159/90 to 199, and stage 2 hypertension is anything greater than 160/100 millimeters mercury.
When it comes to managing your hypertension, the goal is to always lower and maintain blood pressures within normal parameters for you as the patient. Because managing your blood pressures can reduce the risk of potential complications such as heart failure, stroke, a myocardial infarction, which is also known as a heart attack, kidney failure, and retinal hemorrhage. So, setting a goal with your healthcare provider that would be a good blood pressure for you to maintain is your best bet. It doesn't have to be your 120/80, the perfect blood pressure, but if anything lower than what it is now is good. So in an effort to manage your blood pressure, you can begin by modifying your lifestyle, one being weight loss, as excess weight can cause higher blood pressures. And with weight loss comes diet. So changing your diet to one that consists of low sodium and is fat restricted is probably your best bet. And you can also increase your intake of fruits and vegetables, and that's just good for your overall well-being. It's also important to note that if diet is something you struggle with currently, you can always refer to a dietitian or have your healthcare provider help you with that. And in addition to diet, which can also contribute to weight loss and reducing your blood pressure, is engaging in aerobic activity for at least 30 minutes per day. That can just be walking if some exercise isn't your forte. And lastly, it's very important to limit your alcohol intake and tobacco smoking, as both of these contribute to hypertension. As I just mentioned, it is always best to start with lifestyle modifications. However, sometimes those don't always work alone, especially in patients with stage 1 or stage 2 hypertension. So antihypertensive medications are also prescribed by your healthcare provider. These medications listed here are common medications that your healthcare provider will prescribe. They don't usually prescribe medications if you are prehypertensive. Prehypertension is managed with lifestyle modifications and monitoring. You should follow up with your provider in 6 months to a year if you have prehypertension. Now, with stage 1 hypertension, one of these medications will be prescribed along with lifestyle modifications. And if you have stage 2 hypertension, 2 of these medications are normally prescribed along with lifestyle modifications. And you normally, with stage 1 and stage 2 hypertension, you normally want to follow up with your doctor or healthcare provider within about a month. It's also important to understand the side effects of these drugs. They can cause hypotension, which is low blood pressure. They can cause orthostatic hypotension, which is a drop in blood pressure when you stand up. And they can also cause dizziness and lightheadedness, which increase your risk for falling. And so you want to be careful to change your position slowly and sit at the side of the bed or the chair for a few minutes before abruptly standing up. Lastly, I wanted to mention that you should take your medications as prescribed, because when you discontinue your antihypertensive medications abruptly, you can have what's called rebound hypertension, and that it results in an abnormally high blood pressure. So with hypertension, it's important to keep a close eye on your blood pressure trends. So it's recommended that you invest in a blood pressure machine of your own and keep a record of your blood pressures and show them to your healthcare provider. So a couple things to note when you are measuring your blood pressure at home. It's important to first choose a cuff that is appropriate for your arm size. If your cuff is too small, you might get a higher blood pressure, and if your cuff is too big, you might get a lower pressure. You should also sit in a chair with your back straight and your feet on the floor and your arm at the level of your heart. And then make sure the cuff is wrapped around your brachial artery like shown in the picture. And lastly, before taking your blood pressure, it's really important that you avoid exercise, caffeine, tobacco at least 30 minutes prior to taking your blood pressure, as these will increase your blood pressure, and then just sit and rest for 5 minutes before taking it as well.
Consistency is key when it comes to managing your chronic hypertension. The American Heart Association recognized how many Americans are diagnosed with hypertension but are unable to manage their chronic hypertension due to the unavailability of local resources. The American Heart Association launched the Check, Change, Control program in August of 2012 in 18 markets across the United States. The purpose of the program is to eliminate high blood pressure as a health disparity among Americans. From July of 2017 to 2018, more than 1,300,000 participants enrolled in the Check Change Control program and had an average drop in overall blood pressure of 7.7 milligrams per mercury. The Check Change Control program is an evidence-based hypertension management program that utilizes blood pressure self-monitoring to empower participants to take ownership of their cardiovascular health. This program incorporates the concepts of remote monitoring, online tracking, and recruiting local health volunteers to encourage other participants. The Check Change Control Tracker is a new online tool that helps participants track their blood pressure readings and connect with a volunteer health mentor to share their results and progress. Visit the American Heart Association website to find a local Check Change Control health advisor near you to help you manage your chronic hypertension. Managing a chronic disease is hard, but managing a chronic disease without access to affordable, healthy foods and beverages, physical activity, and food security is even harder. The San Joaquin County Public Health Services Department has the Health Promotion and Chronic Disease Prevention Unit that offers support for these hardships through the Nutrition and Physical Activity Program. This program creates partnerships that empowers low-income San Joaquin County residents to increase access to and consumption of healthy foods and beverages, physical activity, and food security with the goal of preventing obesity and related chronic diseases like chronic hypertension. Education, outreach, and environmental interventions are used to assist behavior changes in homes, schools, work sites, and communities to create environments that are more conducive to an active and healthy lifestyle. For more information, call 209-468-8637 or visit the office at 420 South Wilson Way here in Stockton.